I'm glad you mentioned the provider landscape because we interviewed Kate Ryder, the founder and CEO of Maven Clinic, a telehealth solution, earlier this week. And she told us that some 35% of counties in the US do not have an OBGYN doctor in that county. And there's a different study in the JAMA Journal, Journal of American Medical Association, indicating that OB-GYN residency applications have declined a little bit in states with abortion restrictions. So how much of your time do you spend talking to doctors, talking to providers, and solving for some of the gaps that are growing in the United States when it comes to maternal care?
Yeah, I mean, we don't spend a whole lot of time talking to providers, but this is a systemic issue, right? Like, it's not a matter of convincing more OB-GYN residents to voluntarily go to these counties, right? Like, you have to create an environment where people are going to want to go and work, right? And this is fundamentally the problem that we're facing as a country when we do these abortion bans state by state. I mean, you're creating entirely different worlds, right? So, for example, 5 years ago, I unfortunately had a very scary, life-threatening emergency where my ectopic pregnancy ruptured. I lost 2 liters of blood, and if it wasn't for living, 5 minutes from a hospital that has a very high-tech and very well-developed and informed OB-GYN team, I would have died, right? And so if you think about these counties, if I had lived in one of these counties, I would have died because there's no way they would have been able to operate and save my life quickly enough because of also the abortion ban, right? Like, technically the fetus is still alive. I'm dying, but the fetus is alive, right? And they would have to weigh these legal options, right? And so this is the biggest concern, I think. When you talk to doctors, they don't want to be put in situations where they can't make life-saving decisions that they have made an oath to do because of legal nonsense, being dictated by policymakers who are not medical experts, who are not, surgeons, who are not women themselves, right? So I think part of encouraging people to go into areas and really like having OBGYNs all over the country, you have to make an environment where they can actually do their work, right? I mean, it's got to be demoralizing to be working in these states where you know what you have to do to save somebody's life, yet you cannot because your hospital administration is telling you that you cannot, right? Like, nobody wants to be in that situation. So I think that's what we have to address more than anything else. There's no other way to get more doctors in these places until we change the law.
And to your point about changing the law, the perhaps silver lining here is that there are a number of abortion ballot measures that voters will vote on in November. We have ballot measures in Arizona, Colorado, Florida, Maryland, Missouri. I'm looking at a list here on the Kaiser Family Foundation. The list continues, and what each state is voting on is a little different. But Sun-Young, I'm wondering, can you talk about the importance of these ballot initiatives and what you're hearing from your community? I don't know if you have your eye on any one over another, but these seem like important measures to give people a voice in an area where I think since the Dobbs decision, a lot of people have felt voiceless.
Right. I mean, if you look at what happened last year with the ballot initiatives, we have heard loud and clear from the American public where they stand on this issue, right? Ohio, Kansas, right? Kentucky, all voted to preserve a person's right to choose when it comes to their reproductive health, right? So I think that continuing with these ballot initiatives are great and fine, but you know what? They're not going to help. You know who they're not going to help? They're not going to help folks like in Mississippi and Louisiana, where the disparities are the biggest, and there's absolutely no political will, right? So this is why we need a federal solution, because if we have to wait for Mississippi, Louisiana, and these really, really conservative states to come around to protecting women's health, there's going to be a lot more women dying, and there's going to be a lot more doctor deserts in these places, especially reproductive health experts, right? And so we need a federal solution. And I think that, the ballot measures are a great way to get people involved in a way to have a voice, because obviously things at the federal level can move a little bit slowly. But I am really hopeful that, people are voicing their opinions. I know that, we are working on getting voters out in Florida. And we are excited that people are thinking about reproductive health as an important issue. And there's this Amendment 4, right, to come out and vote for Amendment 4. And I am guessing this is the case in other states as well, that, we need to give people something very concrete to make a decision on, because I think so far, for too long, this country's been immobilized and completely frozen in being able to make any big decisions, except for Supreme Court that keeps, chipping away at our rights and creating it more difficult and more dangerous for people of reproductive health to have the access to healthcare that we need.